Good afternoon. House General Laws ABC Subcommittee, ABC Gaming Subcommittee is in order, and we have 5 bills before the subcommittee, and I'm going to start out of order here with House Bill 1509, Delegate Siebold, who's on the committee, and she's going to present her bill very quickly.
Thank you, Mr. Chair. Mr. Chair, members of this committee, there's a substitute to my bill.
Move the substitute. Second.
All right, the substitute has been properly moved and seconded. All those in favor signify by saying aye.
Aye.
Against? Okay, the substitute's before us. Thank you.
Thank you, Mr. Chair. The substitute defines a vape store as a store whose sales of nicotine vapor and hemp products intended for smoking exceed 35% of their total sales. Now, given that we have the definition of a vape store, it then prohibits this vape store from opening within 1,000 feet of a youth-oriented facility, including schools, playgrounds, and daycares. HB 1509 is a vitally important bill to clamp down on predatory nicotine vape and Delta-8 sales to minors. For those who may be unaware, Delta-8 is a synthetic THC product that is not FDA approved. In fact, the FDA states that Delta-8 products may pose a serious health risk to consumers. While Delta-8 products are technically illicit, one walk down Broad Street, right outside our doors, shows that they are currently being sold at almost every corner store. These products here, and I purchased one just yesterday to our members of the members of our committee could see. These products were also purchased by my 24-year-old staffer, I should say, who did not get ID'd. The regulations regarding Delta-8 in this bill are more stringent and impose civil penalties that go beyond existing law, including banning the shops that sell these products near youth-oriented facilities. Despite existing law, this additional regulation is a vital step to protecting our children. In my district, I've heard countless stories of children as young as 11 years old who are able to purchase liquid nicotine vapes and Delta-8 products and distribute them to other underage children. Recently, in my district, we held a town hall on this issue. One mother detailed how her 13-year-old daughter was repeatedly able to buy vapes and Delta-8 pens from the same vape store right across the street from her school. When the mother contacted law enforcement, they said their ability to crack down on the seller was limited based on our current law. And so the predatory sales went on, and these products continued to flood our schools. With flavors such as blue cotton candy and strawberry pina colada, which I also was able to purchase down the street, if any of the members would like to look at. Vape companies are actively marketing their products to children, hoping that they will become addicted to nicotine and will keep coming back for more fun, kid-oriented flavors. In my district, we've heard stories of underage students acquiring Delta-8 pens and going to high school where they are getting high, significantly affecting their ability to learn and have a negative long-term impact on their mental health. There have even been cases of children experiencing severe illness and requiring hospitalizations after consumption, effectively being poisoned by these unregulated and untested products. A 2019 systematic review of both U.S.-based and international studies found a positive association between a higher density of stores near schools and youth susceptibility to future addiction. One study found that schools with more stores within walking distance have higher vaping prevalences than schools with fewer retailers nearby. This bill cracks down on predatory sales and marketing, including penalties for predatory sellers, education for employees, and restrictions on the number of products that can be acquired in a single purchase. Mr. Chair, I'm also aware that there are several other bills before us today, but none of them address the issue of Delta-8 intoxicating hemp products or getting our kids high and poisoning them. This is why this bill is also critical, in addition to our other efforts to regulate nicotine vapor products. I ask the committee to please consider this bill. Thank you, Mr. Chair.
Thank you, Delegate. We have a number of people in the audience and online that would like to testify in support and against this bill. And this bill is number 1509. And what I'm going to do is give 5 minutes to each side and then go online and give 5 minutes to each side that are online, because we have a very big amount of people, maybe more people online than we have in the room. And so what you've got to do is, if you don't get to you, then at the end I'm going to ask for a show of hands for and against, so everybody gets a chance. And then I'll read out the names that are online so they also get their names into the record. There's also the opportunity to send written testimony to the committee even after the meeting's ended so that you can be in the record as well. So this is just HB 1509. We'll start with those people who are for, and there's 5 minutes, and the clerk will keep time. 5 minutes for you to speak. I would line up pretty quickly over here, maybe right to the right if you're for it. It doesn't really matter. Just come up close and don't worry about blocking other people's views because it'll move faster that way. And keep in mind that when you use up all the time, that means the people behind you didn't get much time, and you're going to get an opportunity to just raise your hand as well at the end. So those people who are supportive of HB 1509, please come to the podium. Well, that makes it simple. Do we have anybody? One coming to the podium. All right, 5 minutes. You don't have to use it all.
Thank you, Mr. Chairman, members of the committee. Daniel Davies on behalf of the Family Foundation. We support the bill and appreciate your support for the bill as well. Thank you.
Thank you very much. Do we have anybody online that's, well, we'll go to the, before we go online, let's go to the people here live who are against the bill. There's 5 minutes for anybody who's against the bill. Please stand up and line up, and if you want to speak, you have 5 minutes total. 1509. Okay. There's nobody here against, but we do have a number of people online that are against, so we'll start with those people online who are for the bill. The clerk will open up the online meeting room, please.
Hi, everyone. I'm Jasmine Huang. I'm in 12th grade, and I go to James Madison High School in Vienna, Virginia. I'm here today to discuss the important bill that is HB 1509. Throughout my experience in high school and middle school, vaping and the use of Delta-8 products have become commonplace in the school environment. Walking into school bathrooms or sitting in the school parking lot, students are immediately hit with the smell of nicotine products. This problem will only get worse if better controls aren't put into place to prevent underage access to these highly addictive products. It's sad to see students and kids immediately vaping the second they leave the classroom or even leaving class to go to the bathroom to vape. I am telling you to vote for this bill to protect and fight for the health of our kids in your youth. I urge you to consider the long-term health implications for our students and the potential impact on our community. Take a proactive step towards safeguarding the well-being of our youth, fostering a healthier environment for learning, and sending a clear message about our commitment to the future. Thank you so much for listening and have a great day.
Thank you. I think Troy Davis, is he on? Online? That's it. Nobody else is left. What about against online? 5 minutes for those against online. No one against? Okay, everybody has evaporated. We had a big list of about 25 people. All right, so we will go to questions from the committee.
Mr. Chairman.
Delegate Torian.
Mr. Chairman, I have a motion.
Okay.
Mr. Chairman, I move that we report HB 1509 and refer to the Committee on Appropriations.
As substituted.
As substituted.
We have a motion and a second to report to appropriations the substitute. All those in, the clerk will open the roll. Thank you. Are you voting against your own bill?
No, she's voting against the second vote. Change it?
There you go.
All right, and we thank you. The clerk will close the roll. The bill reports and refers for a vote of 8-0. Thank you. All right, the next bill we're going to entertain here is Delegate Wilt, HB 1018.
Thank you, Mr. Chairman. Committee members, before you is House Bill 1018. It was brought to, I bring it at the request of the Attorney General's office. Basically what the bill does, it brings in a few code sections that explicitly allows the Office of Attorney General's tobacco enforcement section, their investigators, to remove unstamped cigarettes when conducting investigations. And Mr. Chairman, the Attorney General's office has someone here right there. So
Okay, before the Attorney General's office comes to the podium, do we have any questions for the delegate? All right, would you bring up the Attorney General's representative, please?
Good afternoon.
Good afternoon.
Oh, do I have a question?
So what's your position on the bill?
Oh, it's our bill. We support it, yes.
Okay. Do we have any questions for the Attorney General's office? And I do, real quick, what's the, why is this an important bill to you?
Well, the original seizure powers for our investigators, I think through accident, neglected to include certain categories of illegal cigarette for seizure and destruction. We have nonetheless continued to operate with seizing unstamped cigarettes, counterfeit cigarettes, and cigarettes that do not appear on the state directory with the permission of Virginia Tax. We're the only agency that's doing it. There's no one else out there actually patrolling and regulating and seizing contraband product. It's just that I noticed that that wasn't actually in the code, and it needs to be because we need to have that authority to continue conducting these seizures without a problem moving forward. But there is no conflict with any other agency. It's not like we're doing something another agency is supposed to have control over. It's just a vacuum currently in the code.
Thank you very much.
You're
That
welcome.
explains it. Do we have any other questions or motion?
Mr. Chairman,
Chairman Torian.
I just like to know who's speaking to us.
Oh, yeah, introduce yourself, please.
Oh, Sean Thornton, sir. I'm sorry. I thought I did when I walked
Okay,
up.
no worries. Thank you. Any other questions or motion?
Mr. Chairman,
Yes, Chairman Torian.
I have a motion.
Okay.
I move to report HB 1018.
We have a motion to report HB. Do I have a 1018? Do I have a second?
Second.
And we have a second. It's probably before us. The clerk will open a roll. Clerk will close the roll. Your bill reports 8-0. Thank you,
Thank you,
Delegate
Mr.
Wells.
Chairman, committee members.
Thank you. Delegate Cherry, HB 815.
Mr. Chairman, members of the committee, thank you so much for the opportunity to present Bill 815. Unfortunately, to Delegate Seabold, I didn't know we could bring samples, but I guess that's okay. This is a technical cleanup bill. What House Bill 815 does, it only impacts the medical cannabis program. It maintains the protections that the program had at the Board of Pharmacy, provides that aligns product expiration dates with industry standards, increases from 6 months to 12 months, and it enhances workforce development to address a workforce shortage. I do have some experts to testify. Were you to have any questions?
Thank you very much. Do we have any questions for the delegate from the committee? Do we?
And with that, I would move the
is there
amendments.
Oh, we have
I
amendments.
would
Thank
ask
you.
that we move the amendments.
Yes. Do we have a motion to move the amendment? So moved. It's moved and seconded. All those in favor signify by saying aye. Aye. The amendments are before us. Thank you, delegate. Anybody on? Council will
Yes, Mr.
report the
Chairman.
amendments. Thank you.
On line 320, after section, semicolon, strike or. And on line 322, after program, insert, semicolon, or. And then on the next line, number 7, that says to the Joint Legislative Audit and Review Commission pursuant to section 30-59.
Thank you, council. Do we have anybody who wants to testify in support besides your experts? Anybody in the room? Anybody against? Is there anybody online? Okay. Do we have any questions? Do we? Oh, there might be some people. Do you want to?
They're with me. They're
Oh,
my
they're
experts.
the expert testimony. Okay, so we have. Do we need the expert testimony? I see no questions from the committee. I think we don't. Do we have a motion?
Mr. Chairman,
Yes, Delegate Torian.
I move that we report HB 815 as amended.
We have a motion to report as amended, and we have a second. The clerk will open the roll. Thank you. The clerk will close the roll. Your bill reports with amendment 8-0.
Thank you, Mr. Chairman, members
Thank
of the
you,
committee.
Delegate. Delegate Hope.
Thank you, Mr. Chairman. Members of the subcommittee, I have House Bill 790. And I believe that there is a substitute.
We have a substitute. Do I have a motion?
So move.
Second.
Okay, the substitutes before, or all those in favor of substitute, please signify by saying aye. Aye. Opposed? Okay, the substitutes rightfully before us. Does the council, do you want to just, no. It's online. It's a big bill there.
It's a big
substitute. Why don't you start with well, it's the substitute is the whole bill, so.
Mr. Chairman, it is. And,
Yep.
and I, this has kind of been a labor of love for the last 4 years, working with stakeholders. And what it does is it regulates the retail sale of vape products and tobacco products in Virginia. It builds off our existing permitting and licensing processes within the Department of Taxation to ensure we know exactly where a lot of these vape shops are, for example. We certainly know where a lot of the retail stores are. There are all the different gas stations and things like that. We know where they are, and they have to register because of the tobacco. But the vape shops don't have the same requirements, and they're popping up as other bills that we've seen. So it has strict prohibitions against counterfeit products, as well as marketing and labeling restrictions on vape products. It will require that retailers scan IDs on any prospective purchaser under the age of 30 to make sure that they're of age to purchase the tobacco product. Finally, the bill requires the department to coordinate with ABC and local law enforcement to ensure that each retailer is subject to unannounced underage buy inspection at least once every 24 months. We've separated the vape products to make sure that the vape stores are under a license issue, and then for the retailers, tobacco retailers, we're going to enhance enforcement. We're going to hire inspectors to go in, very similar to what ABC uses for alcohol, go in there and make sure that they're not selling to underage. And the consequences for selling underage are drastically increased fees. So for the first violation, it'll be a $1,000 civil penalty. For the second violation, it would be a $5,000 civil penalty and a 30-day suspension of their tobacco license. And a third violation would be a $10,000 civil penalty for 3-year revocation of license. It's really stiff penalties, but people also recognize that we've got a law that sells underage. You can't sell underage, and it will be enforced. And it hasn't been enforced to the degree that it should be. And this has taken action to do that. I want to thank all the stakeholders that have gotten us to this point. Certainly the vape industry has been adding input into this, making sure that people are adhering to the laws on the book in the Commonwealth, and also the tobacco retailers have heard and met with them extensively to get their input into the product that's before you today.
Thank you, Delegate. Do we have any questions for the delegate from the committee? Do we have folks in the room who want to, we're going to do the same thing, 5 minutes for each side, and then we'll do 5 minutes for each side online. So the clerk will start the clock running right now. 5 minutes in support. Thank you.
Thank you, Mr. Chairman. My name is Dylan Bishop. I'm here on behalf of the Virginia Smoke-Free Association. We represent the independent vapor products manufacturers, wholesalers, and retailers. And we want to thank the patron for his diligent and tireless work in bringing stakeholders together, of course, our colleagues on the convenience store industry and others. We think we've found or come as close as we can to peace in the Valley. We recognize that there were some glaring holes in our regulatory framework, or more accurately, our lack thereof, in the vapor products industry. And this is our effort to come forward and say, let's bring light to the industry. Let's make sure that the Commonwealth has the tools that they need to properly regulate the substance. This would give the Commonwealth a full roster of market participants. It also gives the Commonwealth the tools they need to remove repeated bad actors from that marketplace that we now lack. So we appreciate the patrons' help and would appreciate your consideration as well. We think this is the best way to address the youth vaping epidemic, and I'm sure I'll be talking to you about other potential ways to address it later. Thank you.
Thank you, Mr. Bishop.
Good afternoon, Mr. Chairman. Mike O'Connor with Virginia Petroleum Marketers and Convenience Stores. And again, appreciate Delegate Hope working with us. We do not oppose the bill. Had a minor, I guess, tweak in lines 82. It has a requirement for electronic verification. We have a lot of stores, country stores and whatnot, who do not have scanners, who do not have electronic verification. And we suggested to the patron that maybe that language would be appropriate for those that have had a violation of the act. And he suggested that maybe as this process evolves, perhaps upstairs, we could look at that language.
Yep, that would probably be the best course. We won't be taking any amendments. Okay.
Good afternoon, Mr. Chairman, members of the committee. My name is Jennifer Faison. I'm here on behalf of the Virginia Association of Community Services Boards, and we strongly support this legislation. Of all of the legislation that's before you that's related to tobacco licensing, we feel like this is the best vehicle for being able to successfully maintain and roll out prevention programs for these products. Thank you.
Thank you. Is there anybody else in the room that wants to testify? Please come to the podium and introduce yourself.
Good evening, Mr. Carriage. I'm the president of the Yemeni community in Richmond, Virginia. We just want you to have a sympathy for all Yemeni Americans in Richmond, Virginia. Thank you. Whatever, we just have a sympathy for them. I appreciate it so much.
Thank you. Do we have anybody online or anybody else who wants to speak against the bill in the room? Anybody wants to speak against the bill? Okay, online, do we have? Oh, we do have somebody online. Annette Nelms. You have 5 minutes. Don't use it all. Go ahead. Can you hear us?
Hi there, can you hear me?
Yeah, we hear you fine.
Terrific. I'm a passionate parent volunteer at James River High School in Chesterfield County, and I have the distinct privilege of working with teachers and school administrators who are, who are truly unsung heroes. To address this epidemic use of vaping products, our teachers spend their planning periods accompanying school administrators into the bathrooms to stop this behavior and to seize these products. When choosing their careers, these men and women surely did not anticipate that they would spend 45 minutes per student, not only collecting the devices, but processing the required paperwork. You multiply that 45 minutes by numerous students, and that administrator's day is hijacked. That's not education. Public or private, this is affecting all students, all across middle schools and high schools. Previous speakers before me about the other bills spoke eloquently. Jacqueline, the student, spoke beautifully about how our students are being impacted by this. And this is not your grandmother and grandfather's nicotine. Do not be fooled. This is highly, highly addictive. And these companies are taking advantage of a very normal stage of human development called adolescence. In an email I sent you last week, I included a stunning pictograph from Stanford Medicine Research Lab. In case you haven't seen it, it demonstrates a variety of vaping products with cigarette equivalents ranging from 20 cigarettes in the small jewel pod, which is about the size of your fingernail, all the way up to 29.5 packs in an ELF bar, which is approximately the size of the original flip phone. Do not be fooled. These companies don't want you to know how many cigarettes are actually in these products. They're using other terminology to explain what is actually in the product. Never mind the different flavors that are being used to tease our children into thinking that it's just vapor. It's not something that's really that harmful for them. If a student needs to use the bathroom not to vape, he or she is significantly impacted by the vapors being exhaled because, as we learned from the VCU researcher who came to our school when we offered a program for parents earlier last year, the chemicals stick to the surfaces in the bathroom and they stick to the clothing and the skin and the hair of the humans around them. Please do not let these companies take advantage of adolescents and hook our children on nicotine while their brains are still developing. Thank you.
Thank you very much. Is anybody else online? We've lost the online feed. Hold on. No, nobody else online at all. Okay, so that exhausts all the time, and we've had all the testimony. Do we have any questions for the final questions? We have a motion to report this as substituted.
Second.
In a second, the clerk will open the rolls.
No, Mr. Chairman.
Okay. Delegatorian.
I move that we report HB 790 as substituted and refer to the Committee on Appropriations.
Okay, we're going to have to destroy the rolls. We have the motion. The motion is to, the chairman of appropriations would like to see this come up, I think, so we can maybe make those last corrections with some of the language so we have a motion before us. It's been seconded. The clerk will open the rolls. Okay, the clerk will close the roll. Your bill reports and is referred to appropriations as substituted 8-0. Thank you very much, Delegate.
Thanks, Subcommittee.
Delegate Willett, you have the final bill in this subcommittee meeting.
Thank you, Mr. Chairman.
Patience.
And I've got a substitute before you.
Of course you do. We have a motion. Okay, it's been moved and seconded. All those in favor of substitute signify by saying aye. Aye. Those opposed? Okay, the substitute is before us. Do you want to describe the substitute?
I'll give you a brief description, Mr. Chairman, just to let you know about that. There's a few things to clarify and add some new language to emphasize that this law would affect and apply to products sold for retail or that are for retail sale. Also provides more specification around the process for the fees that are remitted during the certification process. And then it changes some of the time frames, for example, increasing the time from 21 to 30 days that a retailer, distributor, or wholesaler who's selling the product has to remove that. Great. I can speak to the bill now, Mr.
Okay,
Chair?
speak to the bill. Thank you.
Yes, no, thank you. Well, Mr. Chairman and members of the committee, I think you've heard already the testimony from earlier witnesses, patrons of vaping-related bills, of the explosion of vaping, the use of that vaping, and really the use of illegal products that are out there. The numbers are staggering. Right now, 50% of the vaping products out there are actually illegal, unregulated products. You'll see these examples, I think, as Delegate Seabold showed you. You can get them anywhere. And you go in any convenience store, you're going to see these products. There are thousands of them out there. And what's happening, what we're hearing, as you heard from someone speaking on behalf of teachers earlier, these are in schools. They're prevalent, incredibly prevalent among young people, because that's the market. That's who's being targeted with these products. And so you have the FDA as the federal entity that's supposed to be regulating these, and they'll send out some cease and desist orders, but basically they don't have a means of enforcing the federal law that would restrict, it does restrict these products. So what several states have begun doing is taking the enforcement piece into their own hands and creating what's called a state registry, where these products have to be registered and regulated through that state. And that's what we're proposing here, Mr. Chairman. The registry would certainly make it more difficult for kids to access these products that are targeted at them. It's also going to make it a lot easier for the wholesalers and the retailers to know what they're selling. That's really a big issue right now. The wholesalers and retailers want to do the right thing. They don't know what the right thing is to do. So to make one distinction, and I really appreciate Delegate Hope's bill. This is a complementary bill. He's focused more on retail sales. This is focused really on the supply chain, the manufacturing of these products. I see the bills as very complementary that way. We need a multi-pronged approach to deal with this issue. It's so prevalent and affecting so many kids, so many families. I could talk more about the bill. I've got some experts on the legislation, what's been done in other states. I would certainly defer to them for more details on this, but I certainly welcome the questions from the committee.
Thank you, Delegate. Do we have any questions from the committee? I have a quick question. So maybe your expert can also just testify a little bit to the efficacy of the bill and why it's necessary. But how does this, you kind of hit on the federal issue, the federal relationship, and that really, from what I understand, the federal government just doesn't have the wherewithal to enforce the laws. And so this is a way it's kind of a workaround, but it's a way that the state can do what the federal government isn't doing. Is that correct?
That's correct, Mr. Chairman. And I wanted to thank the Attorney General's office for stepping up here. They already, I think you know, already do enforcement on the sale of cigarettes. This is going to be a parallel effort by the same folks, but targeted at vaping, and I really appreciate their effort. The bill, we'll talk more about this in appropriations if the bill moves forward, but the funding mechanism will help to get them additional staff to do that.
And what's their position on that? Is anybody from the Attorney General's office here? Here we go.
I think, I don't want to speak for them, except to
comes,
say that we
yeah.
did work closely with
Here.
them. Oh, come on up. There we go. I didn't see you in the back.
Sorry. Good to see you. Hi, good afternoon. I'm Leslie Haley, Deputy Attorney General of Government Operations, and we have been significantly involved with the delegate in helping craft this bill and are definitely on board with the role that we are designed to play in this.
Thank you very much. Do we have any questions for the Attorney General's office? Okay, seeing none, why don't we open it up? We'll do 5 minutes in support and then 5 minutes against, and then we'll go to the online audience. So everybody who's in support, you have a total of 5 minutes, and you can show us your products that you have there.
It's obviously show and tell day here, Mr.
Yeah.
Chairman, at
Thank
the ABC Subcommittee. So thank you. David Halleck with Two Capitals Consulting on behalf of Altria, and we appreciate Delegate Willett putting this bill in. This is an effort, as he said, that's been going on around the country in multiple states to try and provide some clarity as to what is a legal product that's properly able to be sold and what are the illicit products in the marketplace. And one of the things is the other states that have put these registries together, one of the things some of the opposition has said is that, there's only a few products out there, we won't have things to sell. Well, this is the Alabama registry. More than 1,400 products that are going through the FDA process in some way, that would still be able to be sold. But what this bill does is, as Delegate Willett says, very complementary to Delegate Seabold and Delegate Hope's bill in that it deals with the front end. Let's at least get 50% of the vapes that are coming into Virginia off the shelves because they are illegal. And then the other two bills deal with the actual sale of, what are legal products in Virginia. So with that, I'd like to introduce Steve Callahan, who's been heading up the project and working with a number of other states, and he'll be happy to answer any questions as well.
Good afternoon. My name is Steve Callahan. I lead up our enforcement efforts for Altria. I want to say we strongly support this bill. Today, there are two markets. There's a market of people, companies that follow the rules and comply with FDA regulations, and then there's half the market that completely ignores them. For example, these two products here are barred for importation into the United States. They're considered illegal by the Food and Drug Administration. We bought them just a few miles from here. This is a common sense solution, this legislation, which will tell retailers what they can lawfully sell and what they can't sell. Thank you.
Thank you very much. So I have a quick question. Right now, if somebody comes into one of the retail shops and wants to buy something, will they know? They would not know that it's FDA regulated or not, or approved.
They would not know if it's illicit or not, correct.
Thank
this
you.
Legislation will help clarify that for the retailer.
Thank you.
And I believe we have some additional retailers here.
Okay, yeah, please come to the podium and you don't have to say much, but you can just say that you're in support. If you want to explain why, certainly, and please introduce yourself.
Thank you. Good afternoon. I'm Ruth Ann Lilly. I'm the SVP of Marketing at GPM Investments. I live here in Virginia in Henrico County, and I'm here on behalf of a retailer that does act responsibly. We do not carry any of these products. We definitely abide by all laws around any situation in the marketplace, and we have operational policies in place around age verification and assortment that's in our stores. We, including some of the federal laws around the Department of Justice signs that we have to hang in very specific places. And we see mystery shoppers come in our stores and ding us for a sign being a half an inch off where it's supposed to be, walking by a display of these illegal products in our competitors' stores and not saying a word. And it could be because they don't know, or it could be because they just don't have the power. We are very much in favor of this bill. I'd also like to say, as a mom of 3, I'm disgusted by the products that I see my children's friends bring in, and maybe even my own. And I've got young children, and it's really, really disheartening for me. So anyway, thank you very much for your time.
Thank you for your testimony. Any final?
And then just one other thing. I have a letter from Atlantic Dominion Distributors, which is a large employer in Virginia Beach that does this, that is extremely supportive of the bill as well, but couldn't be here today.
Thank you very
Mr.
much.
Chairman.
Good afternoon, Mr. Chairman, members of the committee. My name is David Mills. I'm here today on behalf of McLean Company. We're supporting this legislation.
Thank you, Mr. Mills. Is there anybody else in support? Anybody against the bill, please come up and introduce yourself. We have 5 minutes for your side as well. Thank you.
Mr. Chairman, again, Dylan Bishop on behalf of Virginia Smoke-Free Association. We're the independent vapor products manufacturers, wholesalers, and retailers. For myriad reasons, House Bill 1069 is well-intended but misguided, and I would assert imprudent policy for the Commonwealth for both practical and legal reasons. The bill does nothing to curb underage sales, predatory marketing practices, or to remove bad actors from the retail marketplace. All it does is corner the market for big tobacco. These tobacco insiders have profit-driven motives behind their advocacy here today. Since the FDA's PMTA process was established in 2019, its effective approval rate for vapor products is 0.00001. Now, I heard some snickers in the audience. You might ask why that is so laughably low. It's because as recently as January 3rd of this year, the Fifth Circuit Court of Appeals has determined that the FDA's PMTA process, as it relates to vapor products specifically, is arbitrary and capricious. This holding is mirrored by the 11th Circuit Court of Appeals, which is a federal court. At best, the constitutionality of the PMTA process is questionable and is likely to be heard in the Supreme Court in the year to come. Now, this list is a handy display here, but I've got a list of my own. As of January 1st of this year, only 23 vaping products have received PMTA authorization. This is the entire list. It's not as flashy, but I can shake it and it makes similar noises. Not surprisingly, the entirety of the list of PMTA-approved vapor products is owned by one of three multinational corporations, one of which you just heard from here today and is behind the bill. Practically speaking, it remains uncertain how state agencies can verify whether a PMTA process is pending. And now I'm reading from a publication of the Public Health Law Center that was published February 1st of this year. It remains uncertain how state agencies can verify that a PMTA application is still pending. While the FDA publishes a list of companies who received MDOs, marketing denial orders for their products, it warns the public that the list is not comprehensive. The FDA also does not publish a list of applicants because of commercial data and privacy concerns. We have no way to verify the veracity or validity of the list. Still reading from the National Health Institute. Further, even setting aside such practical concerns, registry laws fall short of protecting youth from accessing e-cigarettes. Thus, even if rigidly enforced, such laws wouldn't necessarily reduce e-cigarette use among vulnerable populations. They'd just be using big tobacco's products instead of others. Still reading from this, from the Public Health Law Center. Registries may distract from more meaningful regulations. Strong tobacco retail licensure laws, like the one that you just voted on unanimously, have proven time and time again that regular inspections, compliance checks, and prohibitions on price promotions and discounts, to just name a few, are all effective measures to protect against youth access and youth e-cigarette use. For many in the public health community, it will be a better use of already scarce resources to develop and enforce robust tobacco retail sales laws that serve to protect youth and the public health overall. Moreover, the bill that you just heard from Delegate Hope would prohibit and severely penalize the retail sale of any of these products in front of you. Now, registry laws similar to the one that you are deliberating right now have been passed in 3 states. In all 3 states, they've either been overturned or legislation has been introduced to pare them back or re-clarify to fix constitutional and practical issues. I appreciate your time today. Thank you.
Thank you. Your time just ran out. There's no more time for folks. No, there's 30 seconds. The clerk has told me. Please come up. Recognize there's 30 seconds for.
Mr. Chairman.
Hold on. We have a question from Delegate Torian.
Before you come up to speak, ma'am, the question that I have for you all who are coming up to speak, any of these products that you are advocating for in this legislation that you are opposing, can you tell me that they are not in stores in Virginia where our kids have access to? Can you tell me that these products are not in our stores?
Mr. Chairman, no, and that's why we're advocating for Delegate Hope's legislation.
Can you, Mr. Chairman?
Yes, Delegate.
And can you tell me that all the products that are in our stores have been approved by the FDA?
No, sir, I cannot tell you.
Cannot. Thank you.
Thank you. All right, the next speaker has the podium. Come on up.
Hi, good afternoon. I'm Maggie Goen, and I'm here representing Virginia Smoke-Free Association as well as VGI Distribution. I oversee marketing and external affairs. We oppose House Bill 1069. The FDA currently has authority to maintain a PMTA registry for these products, and they oversee enforcement. This bill creates nothing but an unneeded redundancy, which will cost the Commonwealth and taxpayers irresponsibly. The vapor industry is in an evolving landscape right now, just like Dylan had mentioned before. There's active litigation with FDA, and just last...
I'm sorry, 5 minutes is up. Thank you very much. Thank you. Do we have any questions for the patron? Any final words?
Mr. Chairman?
Delegate Torian.
Have a motion.
Go ahead.
My motion is that we report HB 1069 and refer to the Committee on Appropriations.
As substituted.
As substituted. Thank you, sir.
Okay, we have a motion to report and refer to appropriations to substitute 1069. The clerk will open the roll. The clerk will close the roll. Delegate Willett, 1069 has been reported and referred to to the appropriations with a substitute. Thank you, Delegate.
Thank you, Mr. Chairman and members of the committee.
That concludes the subcommittee. There's another subcommittee next, and then after that it's a full committee, and we'll be in this room for a little while longer. Thank you very much.